Good morning. This case study is presented by Dimple Barrow and Aditi Jain from Semester 2 MA MCJ. For our campaign, we have selected National Immunization Days. Under this campaign, 2 drops of oral polio vaccine is given to every child under 5 years of age. Organizations including the Indian federal and state government, international institutions, and NGOs heavily support this campaign. National Immunization Day is a part of Global Polio Eradication Initiative, which is headed by Rotary International, the WHO, UNICEF, and the US Centers for Disease Control and Prevention.
Let's move to the polio vaccination history. When did the polio vaccination started in India? In 1994, a pilot immunization activity was conducted in Delhi. 1 million children up to the age of 3 years were targeted. And it went further by targeting nationwide population. In 1997, a project for polio surveillance was established. Later, in 2001, UNICEF set up a network in UP and started the campaign by appointing Mr. Amitabh Bachchan as the brand ambassador. In the year 2005, monovalent oral polio vaccine was introduced, which is usually given to children older than a year. Finally, in 2014, India declared a polio-free country. So, what is polio? Polio is a life-threatening disease, also was one of the most feared viruses in the industrialized countries. Although it was unknown before 20th century, but in 1900 it became visible in Europe. It causes paralysis, affect the spinal cord and bones of children. The UNICEF campaign to fight with polio was set up with the objective of awareness and eradication of the disease. As we analyze the process, started by awareing people, motivating them to opt their children for vaccination. After a proper vaccination drive, eradication could achieve through promoting healthy essentials was the process. The target location was the entire nation, as the situation demanded the urgency of the campaign. A state like UP, Bihar, and West Bengal was more focused. Coming to the participants. The primary participants were the parents and family of children up to the age of 5 years. Initially, the target was 3-year-old but later shifted to 5-year-old children. The secondary participants were the doctor, government of the nation and state. As it was a national health campaign, government support and collaboration was needed. Behavior analysis. Behavior analysis of primary participants were lack of knowledge. A lot of misconception regarding the vaccines were there. The lack of trust was a hurdle to clear. The behavior analysis of secondary participants were the focus on government. As India was an underdeveloped country which was unable to invest in vaccine research and lagged in handling the nationwide campaign of millions of population. Behavioral objectives. It was necessary to create the awareness first so that vaccination could be done. Secondly, the focus on eradication of the disease was necessary to clear the nation's children's health issue. Third is to motivate people to accept the vaccine without any fear. All this can be done through meeting with people, communicating, and strict monitorings of the polio data. The communication objectives of the campaign were to spread awareness, knowledge, motivation for treatment, information about the healthy measures, collaborating with the government for proper functioning, training of doctors and staff to communicate the seriousness of the disease.
Let us look at the various communication approaches this campaign has. First is the underserved strategy. It started in Uttar Pradesh from 2002. UP population consists of 59% children being paralyzed by polio. Hence, a formal partnership between national Islamic universities were formed. They declared that the vaccine was safe to consume. Jamia Millia Islamia University produced the Green Advocacy Booklet, which is a collection of Quran verses supporting the polio vaccine. Since then, 500 madrasas and Muslim institutions have joined the partnership. In Uttar Pradesh, which is a high risk area for polio, 85% of mosques declared the polio related advertisement and other necessary details about the Polio Sunday. 25 district underserved coordinators have been hired and deployed in Uttar Pradesh. They communicate with the local imams and other key community influencers like elders to spread awareness for the vaccine. The strategy also covers marginalized groups. They are constantly monitored and necessary initiatives are taken to provide them proper hygiene and water supply. An important element of this strategy is to ensure the sole message to vaccinate children against polio is upfront during religious gatherings, for example, Eid. Next is mobile and migrant strategy. Migrant children are constantly on move with their parents and can miss out on the vaccine, especially in Bihar where rate of migration is higher. This campaign provides vaccination at train station, bus stand and busy intersections. Earlier in Bihar, it was common for 10% children to miss out on vaccination, but now it is only 1%. During large gatherings of Chhat Puja and Sonepur Mela in Bihar, the transit team vaccinates the children. 81 vaccination posts now vaccinate children crossing Indo-Nepal border. 5 vaccination posts are in India-Pakistan border. Furthermore, 14 railway stations in Bihar provide polio vaccines. UNICEF's polio program in 2012 identified 40,000 migrant sites along with 22,000 informers to help the social mobilization network groups reach the migrants with vaccine related information. The vaccination team then reached out to them providing the oral polio vaccine. UNICEF recruited 40 block level SMNet members in Uttar Pradesh and Bihar to identify and track the high risk groups. 25,000 migrant families have been identified and tracked for vaccine this year. The informers keep a track of migrants, nomads, and slum dwellers. They inform the UNICEF block mobilization coordinators. The vaccination teams are sent to these sites to vaccinate the children. UNICEF works with aid metrics to reach private sector corporations that are keen to support the campaign with CSR funded interventions. Aid Metrics places messaging in strategic locations to reach out to the migrants. They also conduct community outreach, including audio-visual messaging, IEC material outreach, placing polio messages in products, etc. It engages telecom companies for widespread communication to spread information about polio and the vaccine campaign. Next strategy is a key component strategy for polio eradication in India. UNICEF in 2002 approached Bollywood actor Amitabh Bachchan to become the ambassador for the polio vaccine campaign in India. This has helped garner community support to the polio booth. This campaign gained distinct recognition due to use of bright yellow, pink and blue color in the polio information and the IEC materials. दो बूंद जिंदगी की, हर बच्चा हर बार, आपका बच्चा हर बार, जहाँ भी जाओ जहाँ भी रहो, पोलियो की खुराक ज़रूर पिलाओ were among the popular taglines. Posters and banners with these taglines were strategically displayed at transit points and during the booth day and polio immunization week. Other celebrities such as Farooq Sheikh, the film star, cricketers like Mansoor Ali Khan Pataudi and Ravi Shastri visited and addressed the families in high-risk areas, which helped break the refusal of vaccine. International events like T20 series in Colombo, India-Pakistan Test Series and One Day International, India-West Indies Test Series, etc. were engaged to endorse polio immunization. Media plays a very important part for the campaign. The reports by the media are tracked and analyzed at the national, state, district, and block levels. Advocacy meetings, briefings, and field trips are ongoing to share with the media the necessary updates of the campaign. The government provides the key spokespeople to respond to and address the media. The partner agencies support government with content and updates. This way, a two-way communication is formed between media and government. Due to involvement of media in a proactive way, the campaign has deemed more credible. The engagement of top politicians has helped send out a clear message of strong government ownership of the program. UNICEF and partners, WHO and CORE, advocate with program managers, religious leaders and institutions, community leaders, elected representatives, medical associations, medical practitioners, and small and big businesses. This has helped build strong community ownership of the program. The next strategy is convergence. India recorded 741 cases of polio in 2009. This was almost half of the global case count of wild poliovirus. 80% of cases were occurring in 107 blocks of Uttar Pradesh and Bihar. The government implemented the 107 block plan. This plan focused on four main areas: strengthening routine immunization, promoting exclusive breastfeeding, tackling diarrheal episodes by promoting the use of oral rehydration salts and zinc, promoting hand washing and other initiatives to improve water and sanitation. A main focus of the polio campaign is improving the routine immunization rates. In UNICEF supported areas of Uttar Pradesh and Bihar, data shows community mobilizers have helped raise full immunization coverage about 70%. Convergence also includes efforts to reduce open defecation by constructing toilets. In Badun district of Uttar Pradesh, 65 lakhs 50,000 dry latrines have been converted into flush toilets. Community mobilizers also counsel the families about the importance of hand washing with soap. The community mobilization coordinators receive the proper hand washing techniques and pass on the knowledge to mothers and the family members during routine house visits or community works. The social mobilization network also works towards improving the quality of water and sanitation. This reduces the spread of diseases such as polio and diarrhea. Members of the social mobilization network are involved in water quality testing and advocating at district level for more improvements. Next strategy is community mobilization. Community mobilization coordinators have become an integral part of the immunization program. CMC surveys the households, records the details about the pregnant women, infants, and children for the immunization schedule. The CMC shares the information with the block mobilization coordinator. The BMC then presents the data to the clinics and the government so that they can provide polio related information and vaccination for the families and children respectively.
The campaign went successfully. By all the strategies and implementation, here are the few samples of their communication activities. Posters of Mr. Amitabh Bachchan were all over the streets and cities with the message in different regional language, spread awareness among the people at large. Banners on roads, auto, etc. were used in regional and national language with the tagline Do Boon Zindagi Ki and its attractive logo. Public service advertisement taking Mr. Amitabh Bachchan as the brand ambassador helped in influencing people and building trust. The entire campaign is one of the most successful campaign in India with the desired result.
Now let us take a look at the PSA.
पालने में नन्हा जब सोता है तब हाथों को दर्द कहां होता है। जब दिखती है लाडली परी सी तो अपनी हालत का किसे होश होता है। अपना हर सपना भुला दिया ताकि उसका सपना हो सके पूरा। पर पोलियो की खुराक पूरी नहीं ली तो उनके लिए जो किया सब अधूरा। इसलिए हर हाल में पिलाइए पूरी खुराक, तब होगी पोलियो से सुरक्षा पूरी। जन्म से लेकर 5 साल तक 2 बूंद जिंदगी की, हर बच्चा हर बार।
अपने 5 साल तक के हर बच्चे को पोलियो की दवा अवश्य पिलाएं।
That was all for our case study. Thank you so much.